Right now, our region has one of the biggest populations of babies born dependent on drugs. News Channel 11's Allie Hines found out today East Tennessee State University is creating a database that it says will help these babies right away.
Josh, so far this year, 779 babies have been born right here in Tennessee experiencing withdrawals from drugs right out of the womb. The highest number the state has seen in recent years. Now ETSU says it is trying to help find the answers to many of the unknowns about Neonatal Abstinence Syndrome, or NAS. Out of the entire state, East Tennessee accounts for nearly half the babies born dependent on drugs.
What happens in the NICU did not start in the NICU.
There are still many questions surrounding NAS, and the state, universities, and local organizations are working to find answers.
We're not going to be able to begin to address that challenge as rapidly as we'd like to until we can get our arms around, and I think we're beginning to do that now as a region, as a state, as a nation. On the whole substance use disorder epidemic.
The state keeps a database of how many babies are born with NAS and in what counties.
They do continue to increase.
And ETSU is starting its own database to find answers.
There's a urgent need for long-term studies. What happens to these babies well into the future? Their school systems are concerned. We really don't know the long-term effects.
Angela Hageman is the Drug Abuse Research Program Director with the College of Public Health at ETSU. She says their research will also have impacts right away.
There are different hospitals participating. We hope to partner with a variety of them, and they'll be able to communicate with each other about what's working with the babies. So right away, I believe outcomes will improve.
Nonprofits are also trying to find answers. Johnson City-based Families Free is on the front lines to try and help moms and babies born with NAS.
We have had 48 referrals of women in the past 3 months.
They are partnering with ETSU's Early Childhood Development Department to track the outcomes of women who complete treatment.
It's really important to be able to tell a story of what really creates change.
It'll be paid for with part of $100,000 the governor recently allocated to Families Free.
We've been able to enhance our presence at the hospital and to have more boots on the ground out in our community.
A community with 200 babies born so far this year with NAS, and a community that's working to stop that number from growing. Allie Hines, News Channel 11 in your corner.
The Junior League of Johnson City gave $20,000 to ETSU's Center for Prescription Drug Abuse Prevention and Treatment just to create this NAS drug database.